Welcome to today's psychiatric nursing lecture. Today we are going to start a new chapter, schizophrenia. Schizophrenia is one of the very important unit. So everybody has to be thorough with the schizophrenic disease condition. In exam, definitely questions will come from schizophrenia unit. No chance to escape. Let's see the introduction about schizophrenia. So basically we know that mental illness is two types. One is psychosis, another is neurosis. So schizophrenia comes under psychosis. So psychosis, first you must know what it is. Psychosis are mental disorders in which the personality is seriously disorganized. The human being personality is completely disorganized. As a result, the person cannot contact with the reality. So all the things related to the reality, like judgment, his perception, everything is affected. So psychosis, a mental condition in which the person is seriously affected with the impairment in the person's reality. So next thing, in psychotic condition, the client's contact with the reality is totally lost. So the client does not know what he is doing. The client does not know where he is. So all the insight is lost for the client. So because of this, so the client will have the signs and symptoms like delusion, hallucination are very common in the psychotic conditions. In case of neurosis, the client will not have delusion and hallucination symptoms. So what is psychosis? So the psychosis also alters the client ability to think. We cannot think properly. Our thinking is totally affected. There is no clarity in our thinking, and there is loss of our ability to make a judgment. So we cannot make any judgment about us, about the surroundings, about our future. We cannot do any judgments. And there is also emotionally it is affecting. Our total emotion is affecting. We cannot respond to some event in a proper emotion. Our emotion is totally altered. We cannot be in a good emotion state, and communication pattern is totally affected. Sometimes we will be isolated from others. Sometimes we try to involve in the communication, and that type of communication will not be a meaningful communication. A person with psychosis will have disorganized communication style, and the person cannot understand about the reality that we already discussed, that does not know what is happening around him. If somebody is coming and standing simply behind him, they used to think that they are trying to harm them. And also the behavior, the total behavior is affected. Their behavior pattern will be abnormal. They may have suicidal ideation or homicidal tendency, and they don't know what they are doing. And sometimes severe psychosis condition will affect the client's ability to meet the day-to-day activities of living. So when schizophrenia affects, when the schizophrenia symptoms are very severe, they don't take care of themselves, even they don't do their day-to-day life activities. So this is about psychosis. Now let's move on to the schizophrenia. So before that, we want to see what are the types of psychotic disorders. So basically, there are four types of psychotic disorders. First is very common schizophrenia. So in schizophrenia, all the psychotic features are present for at least 6 months. Along with that, impairment in the occupational and social functioning of the client is seen. Whereas in case of schizoaffective disorder, there will be psychotic symptoms as well as mood disturbance. Schizoaffective. Schizo stands for psychotic problem. Affective stands for mood related problems like depression. So at a time, patient may have schizophrenia as well as mood disorders like depression together. Schizophreniform disorder, the signs and symptoms are same like schizophrenia, but here the client does not have affect in the social function day-to-day life. Only the signs and symptoms are similar like schizophrenia, but the person can do the normal day-to-day activities in the society. So these are the schizophreniform are like mild, we can say it is a mild schizophrenia disorder. The next one is brief psychotic disorder. So this brief psychotic disorders usually have the symptoms similar to schizophrenia, but for very short period of time, like 1 to 30 days. So these are the types of psychotic disorders. Now next we move on to the next thing. So what is schizophrenia? Schizophrenia, the word comes from the Greek word schizion means split, phren means mind. Schizophrenia, it's commonly known as splitting of the mind. Schizophrenia means splitting of the mind. The word schizo means split, and the phren means mind. So the term schizophrenia indicate splitting of the mind. So this term schizophrenia was first coined by the Swiss psychiatrist Eugen Bleuler. Eugen Bleuler first coined the name schizophrenia. He is from Switzerland, and in the year 1908, this name came through Eugen Bleuler. So, according to him, the splitting of the mind means separation of the functions between personality, thinking, memory, and perception. So, the mind's together function, the holistic function of the mind is split. It becomes separate because of the various psychopathology behind this illness. So, symptoms of functions, the main symptoms are around the personality impairment, thinking retardation or abnormal thinking pattern, poor memory, also misperceptions. So this is the small brief introduction about schizophrenia. Now the schizophrenia basically characterized by disintegration of the thought process and emotional responsiveness. The person cannot think properly, as well as his emotional responses with others are totally affected. So the person with schizophrenia does not show appropriate emotion towards others for any kind of situations. So according to ICD-10 classification, the schizophrenia comes in the F22, F29 category. So this is the alphanumeric code which indicates the schizophrenia condition. So from F20 to F29 we have F21, F21, 22, 23 like that. So everything indicates different types of schizophrenia. Now let's move on to the epidemiology of schizophrenia. So basically, the schizophrenia affects people all over the world. Approximately 0.3 to 0.7 percentage of people affect at some point of their life. So in our life, there is chance for getting schizophrenia is 0.3 to 0.7 percentage approximately at any time it may happen. In each year, all around the world, 10,000 people, more than 10,000 people, that is 1 in 10,000 people in the age 12 to 60 years gets affected by schizophrenia. 1 in 10,000 person in the world is getting affected by schizophrenia around the age 12 to 60 years. It is diagnosed more frequently, that is 1.4 times more frequently in the males. So schizophrenia patients, mostly males are very common, even though it affects females, the rate is higher in the males. Whereas the peak onset age of schizophrenia is between 20 to 28 years for males, and for females it is between 26 to 32 years. If the schizophrenia comes in the middle age, or if the schizophrenia comes in the old age, it can be treated easily. But when the schizophrenia comes in the childhood, it is very difficult to treat. Even if the schizophrenia comes in the adolescent period, it's very difficult to treat. And the poor onset, like the in childhood, the onset of schizophrenia is very rare, and around 1 percentage of worldwide disability adjusted life years. So, so those who have disability in living their life all around the world is around 1 percentage. So this is about epidemiology of schizophrenia. Now let's move on to the next important thing. What are the etiology causes of schizophrenia, or the etiology of schizophrenia? There are a lot of causes. Let's see one by one. First, let's see the genetic theory. So schizophrenia inherit from generation to another generation. Around 10 percentage of the people who got schizophrenia is from first degree relatives, genetic characteristics like mother, father, brothers, sisters. So when the first degree relatives have schizophrenia, a client can get 10 percentage increased risk. From the second degree relatives like uncle, cousin, auntie, schizophrenia is also the occurrence of schizophrenia is also very commonly observed. So, in the family history, schizophrenia plays a very significant role, either through first degree relatives or from the second degree relatives. Identical twins, twins with same gender, have the very severe risk factor around 40 to 65 percentage. Whereas the dizygotic twins have less chances to get schizophrenia, but monozygotic or identical twins have severe chances for getting schizophrenia. Neurological causes. Post-mortem studies in schizophrenic patients found that there is some abnormal structural anomaly in the clients with schizophrenia. There are also chemical abnormalities for the clients with schizophrenia. Basically, the impairment occurs in the frontal lobes, hippocampus, and temporal lobes. So, schizophrenia commonly affects in three areas of our brain. Structural impairment can notice in the frontal lobe, in the temporal lobe, and in the hippocampus. Also, the neurotransmitter dopamine level, if it is high, that can be associated with the schizophrenia pathology. So this is about the neurological causes. Next one is the environmental cause. Because of the urban environment, because of the urbanization, because of parenting style, poor parenting style, very strict, rigid parentship with the children, or very liberal parentship with the children also can lead to schizophrenia for the children. And social isolation, when they don't have adequate amount of support system in the society, like friends, when they don't have proper family, they also get the schizophrenia very easily. And family dysfunction, when there is frequent fighting and quarrels among the family members, particularly mother and father, that leads to schizophrenia to the child. And when we don't get proper support from the family, that may be also the one of the increased risk factor for getting the schizophrenia. Unemployment, in another hand, is very common associated for schizophrenia development. And poor housing conditions, when the housing setup is not good, then there is very high risk for developing schizophrenia. Similarly, drugs like cannabis, cocaine, and amphetamine usages that also can provoke schizophrenia signs and symptoms in the clients. So this is about the environmental causes. The next one is the biochemical cause, which already we have discussed. In our body, some chemical imbalances are found. Particularly, the people with schizophrenia have increased level of dopamine and glutamate in their blood. So dopamine level and glutamate level should not be high in the brain. The next important thing is the ventricles. Fourth ventricles are found to be very larger in the diameter in the schizophrenic clients. And finally, the people with schizophrenia will have less gray matter. The people with schizophrenia will have less gray matter. So next one is prenatal factors. So during antenatal period, if there is risk for getting infection, and during the time of delivery when the baby gets hypoxia and any other congenital infection that leads to schizophrenia. And particularly if the child borns during the winter time, there is chance for occurring more viral infection. So that may cause schizophrenia to the client. So this is about the prenatal factors. And now let's see the psychological factors, various theories we have studied. One of the theory is very popular theory, psychoanalytic theory given by Sigmund Freud. According to this theory, abnormal upbringing of the child, like the parents are very cold with the child, rejecting behavior with the children, and schizogenic mother, the mother who never cares the children. So these children develop weak and fragile ego. So in future, this poor ego development will be the highly sensitive risk factor for getting schizophrenia. The next behavioral theory. The behavioral theory says that people learn the abnormal thinking, abnormal behavior pattern from those who have schizophrenia undiagnosed. So by seeing some person who have the signs and symptoms of schizophrenia when they left undiagnosed, they try to follow them as their role model. So this is about the behavior theory, which speaks about the causes of schizophrenia. Socio-cultural factors which causes schizophrenia, like stressful day-to-day life events, and because of the loss of job, death of close one, loss of property, poor communication patterns, and schizophrenia is very common because of the poor communication pattern style, abnormal communication with others, and because of the ambiguous communication style. So, opposite desires towards a person, towards a situation, towards a thing, that also leads to schizophrenia very commonly. And finally, the another socio-cultural factor is high express emotions. So when you abnormally expressing your emotional feelings towards others, that also will lead to schizophrenia. The risk is four times more higher when you express the emotion in a high way. The person who have the person who have less emotional expression, they will have less chance to get schizophrenia. So this is about the various etiological factor of schizophrenia. Now let's move on to the next thing is signs and symptoms of schizophrenia. So before studying the classification of schizophrenia, here we are going to study the signs and symptoms of schizophrenia. First signs and symptom, basically three types of signs and symptom is there in schizophrenia. First we are going to see the very common signs and symptom that is called Kurtz-Schneider criteria of schizophrenia. Coach Kennedy given the criteria for diagnosing schizophrenia. So the symptoms given by Kennedy are called as first rank symptoms of schizophrenia. So in exam question comes like first rank symptoms of schizophrenia. Then you want to write the answer from this slide. That is Kennedy criteria, or it is called as Kennedy first rank symptoms of schizophrenia. So let's see the first rank symptoms of schizophrenia. Symptoms. First one is audible thoughts. Usually the thoughts comes in our mind, but for schizophrenic client, the thoughts comes in the form of voice. That is audible thoughts. Second one is voices arguing or discussing or both. So the patient with schizophrenia hears voice which is arguing with them or discussing something with them. Basically, we never hear any voices when there is no stimulus from the nearby person or when we are alone. But schizophrenics will hear some sound stimuli like arguing stimuli or some kind of arguing or some other like discussing sounds will be heard in the patient's ear. The next is voices commenting. So this is another type of this hallucination. So voices comes in the way that it command the client to do some activity, go there, do that. Like that commands will be given by someone in the client's ear. That is called voices arguing or voices commenting. The next one is somatic passivity experiences. So here the patient have some body symptoms like fatigue, lethargy, tiredness, malaise, weak, somatic passive experiences, unable to initiate any activities. So these kind of symptoms are present. The next thing is thought withdrawal and other experiences of influence thought. Like the patient usually thinks that there is no thought present in her mind. Every thought has been taken out of the mind. That is called thought withdrawal. So when we ask them to say something, they don't say anything. So they just say that my thoughts have been taken by someone else. So that is thought withdrawal. Next one we have that influence thoughts. They used to say that somebody has kept their thoughts in their thoughts. Some of the people's thought has been kept inside the patient's brain. So that is thought. This one insertion. Next common thing is thought broadcasting. So patient feels that what he thinks, what he views, that is shown in the television, that is telecasted in the radio or television. The next one is delusional perception. So for each and everything, the client do misperception. For example, when seeing the traffic red light signal, the client says that some aliens are going to land here. That is the signal for the landing of aliens. The next signs and symptom is all other experiences involving volition, made affects, and made impulses. So patient does not involve in any activities, volition, and patient does not have any affects, does not show emotion, facial expression, very blunt facial expressions, and patient will have made impulses. Patient do anything without understanding the consequences. Next, we will see the second rank symptoms of schizophrenia. So it is less common. First thing, there will be disorders of perception like delusion, illusions will be commonly present. Each and everything they misinterpret. Sudden delusional ideas comes in the mind, like suspicious thoughts, like grandiose ideas, nihilistic delusional ideas. These are frequently occurring in the client's mind. And depressive and euphoric mood changes. The mood is not stable. The mood is labile. Patient goes to the state of either depressive or patient goes for the state of happiness, that is manic phase. The next important thing is feelings of emotional impoverishment. So patient does not show any kind of emotional reaction towards any activities in the life. That is because of impoverishment. Patient feels that he does not have enough amount of emotions to exhibit. The next we are going to see the four A's of schizophrenia. Eugen Bleuler's four A's of schizophrenia. So first A stands for ambivalence. Ambivalence means contradictory or opposing emotions, attitudes, ideas, or desire for the same person, things, or situation. So patients have two different ideas for the same person, same thing. They, for example, they have ideas like to go for marriage. At the same time, they have idea will not go for the marriage. They like a person at same time they dislike a particular person. So that is ambivalence. Next one is autistic thinking. So it is the disturbed thought process. Here the individuals were unable to relate to others or to the environment. So they see something in the environment that they cannot understand. So that is autistic thinking. The thought is totally affected. Sometimes they do the proper thinking only for with certain things with certain peoples. And next one is affective disturbance. So inability to show appropriate emotional responses. So here in marriage they used to cry or during the funeral time they used to laugh. That is affective disturbance, inability to show appropriate emotional response. When someone beats they used to laugh. When everyone laughs, they used to hurt others. Next one is the last A in the 4A is loosening of association. So patient does not have any thing to think logically. So everything the patient thinks in a illogical way. And the content, when you ask the client to speak about something, they does not have adequate content. That is because of loosening us. So when they talk more thing, we cannot relate one point with the another point. So that is loosening of association. Now another important signs and symptoms of schizophrenia is difference between positive, negative and cognitive symptoms of schizophrenia. The positive symptoms of schizophrenia are overt symptoms commonly present outside and that should not be present. Usually these symptoms are commonly present outside. Basically, they should not be present in the client. And this negative symptoms does not refer to the person's attitude, but instead it is referring to the lack of characteristics that should be present. So let's see the positive symptoms first. So positive symptoms including hallucination, delusion and disorganized thinkings. So hallucination you know very well. Like patient hear voices. Patient can see someone standing in front of them, but really when there is no one standing. So that is hallucinations, different types, auditory as well as visual hallucination. These are common. Sometimes patient will have gustatory, tactile hallucination. These also another different types of hallucination. So what is delusion? Fixed, false, unshakable belief. Patient have different types of delusion like paranoid delusion, grandiose delusion. So Each type of delusion will have big impact on the client's health. And you know that the thoughts are disorganized. Patient cannot make the thoughts in a correct way. So every thought what is comes into the patient mind is in a disorganized way. Okay, now let's see the negative symptoms. Negative symptoms does not seen outside. Basically, it is covert symptoms. So let's see one by one. First one is reduced speech. The amount of words the patient use while speaking is decreased, and there will be, even when we ask them to speak, they don't come with adequate content to speak. The next one is lack of emotional and factual expression of intellectual, this one, of the affective reasoning. So no facial expression. There will be very flat mood, flat facial expressions will be there. Apathy, lack of emotional feelings will be there, and diminished ability to begin and sustain activities and any work. So if we ask them to start any work, they don't come forward to initiate that activity. The client does not start any activity and they lose the interest to complete the activities which they have started. In between, they come out of those activities. The next one is the decreased ability to find pleasure. That is called anhedonia. Those activities which had given pleasure to the client will does not give same kind of pleasure at present when this psychopathology is seen in the client. That is anhedonia. And last one is social withdrawal, asociality. So every time they will be alone, they never join with anyone in the community as well as social settings. The cognitive defects of schizophrenia, this aspects like we have impairment in the memory. So there will be three types of memory abnormality: impairment in the immediate, recent, and remote memory. And the next one is they have attention difficulties. Any kind of activities they cannot sustain for a long period of time. There will be poor planning. They don't do their day-to-day activities by themselves because of the poor planning. They have lot of stress. And finally, the decision making will not be logical. The client with schizophrenia who have cognitive deficit, they cannot make decision properly. So their decisions are not accepted anywhere. So this is about the positive, negative, and cognitive deficits of schizophrenia. So in this video, we have seen what is psychosis, what are the types of psychosis. Also, we have seen the schizophrenia, how the word comes, and what are the characteristics of schizophrenia. We learned about the causes of schizophrenia, and also we learned many things about the signs and symptoms of schizophrenia, like Eugen Bleuler's 4 A's of schizophrenia. That is the fundamental symptoms given by Eugen Bleuler. And another one is Kennedy's first rank and second rank symptoms of schizophrenia we have studied. Finally, we have seen what are the positive symptoms and negative symptoms of schizophrenia. So this is the end of the first session for schizophrenia. In next session, we will continue with the various types of schizophrenia, how these types of schizophrenia differs from one another. Let's see. Still then, take care. Bye bye. Thanks for watching this video.